Speaker, my question is to the Minister of Health and Long-Term Care. Minister, I'm very concerned about the state of Ontario's healthcare system and the availability of doctors in my riding. Under your imposed contract with the doctors in Ontario, you're prohibiting new doctors from joining family health teams in well-serviced areas. However, your government's model in defining well-serviced areas is extremely flawed. My ride has experienced a shortage of doctors for a number of years. The City of St. Thomas, Elmer, Rodney have lost up to 6 doctors, and in fact, the municipality of Dutton-Dunwich has only had 1 doctor for a number of years. Minister, too many people in my riding are without doctors. In fact, a number of the doctors in my riding will be retiring in the next 3 to 5 years, and your current model of family health teams will not allow for succession planning. Minister, can you share with me your plans to address the doctor shortage that you have created?
Thank you. Minister of Health, Long-Term Care.
Thank you, Mr. Speaker, and thank you for the question. Opposite, actually, I have good news, because what we're doing with the changes that resulted from the OMA's refusal to walk away from the table after a year of negotiations and not accept the fair offer that was presented to them and the fair offer that was recommended by, frankly, the umpire that we brought in, retired Judge Warren Winkler, who was our conciliator, aiming to actually bring the 2 parties together. He said that the government's offer was a fair offer and actually implored the OMA to accept our offer as well, feeling that it was fair. But what we've done with our family health teams for our important family doctors that are graduating is precisely what you're asking for, is we're directing those resources to those parts of the province that need them both. So to the underserved areas, the areas where there are doctor shortages, where we need to make that added effort to make sure that our family doctors, that frankly broad family health team, the professionals that provide that important care, go to those areas of the province that need it most.
Thank you, Speaker. Minister, what's not fair about the system is the fact that your system classifies my area as well-serviced, which it's not. It's flawed. And under this new decision you've made with the Ontario doctors cannot come to my riding. Minister, it's clear that you have no plan for the healthcare systems. You're ignoring the groups like Ontario Medical Association who want to work with you, who have plans to make the system better. Not only has your government stopped new doctors from joining family health teams, you have now threatened doctors to penalize them who see too many patients. Minister, the baby boom generation is growing. It's a tremendous increase on the usage of our healthcare system, yet your government cuts services and access to healthcare in order to balance the budget. Minister, why are you cutting healthcare to make your government's financial budget commitment?
Question. Thank you.
Well, Mr. Speaker, I don't quite know where to start. We aren't cutting health care. The health care budget continues to increase year over year as it has for many, many years. The physician services budget, which is currently $11 billion, 10% of every dollar that this government spends in the province, that fund for physicians specifically is going up by 1.25% next year, 1.25% the year after that, 1.25% the year following. We are increasing health care. We're committed to our family health teams. More than 3 million Ontarians currently have access to a family health team. But I, quite frankly, Mr. Speaker, I'm disappointed at the response at the question, because we worked hard and diligently and with good faith intentions with the OMA for over a year and a day to be exact. The retired Judge Warren Winkler came forward as an independent umpire. He took our side, Mr. Speaker. He asked the OMA to accept a fair offer.
Yeah.